I literally just finished Instagram stalking you guys. And like, I love y'all's vibe. Like your website, I love that you put like each one of your different vibes. I was like, ooh, they're going to be fun to talk to.
I hope so.
Oh, for sure you will.
What you see is what you get with us. So
it really is.
And that is literally the vibe that I felt. I was like, they're going to be open, honest, and quite honestly fun. Talk about your credentials, years in the field.
So I'm a licensed chemical dependency counselor. Just recently took the LPC test, and so both of us are in that position where we'll be LPCAs. For the last 17 years, I was the director of intervention counseling, and I am originally from Grand Rapids, Michigan. I did my undergrad at Bennett College, which is an HBCU in Greensboro, North Carolina, in psychology as a bachelor's of arts. And then I went back home and did my master's program at Western Michigan University in counseling psychology.
Okay.
And received my master's in 97.
Hey, Dr. TJ.
So I came into counseling via speech pathology and audiology.
Oh, like you have like completely different sides.
So my bachelor's degree, I attended Tennessee State University, which is a HBCU in Nashville.
Okay.
And I got my bachelor's in speech pathology and audiology. Okay. So I went straight into a doctoral program for audiology.
Okay. So you like went from your master's straight
from
into
my bachelor's straight into a doctoral program.
Okay.
And I flunked that with a B-. And I was like, right. I was like, when I saw B-, I was like, whoo, just made it. They were like, no. We said B. You got B-.
It's still a B.
Right, that's what I said. But I always say it was a God move, because that's how I got into counseling. I went back to Nashville and I was talking to one of my mentors, and just like, I was like, well, I really like working with kids, and even with audiology, like these kids got issues, and like I feel like I should talk to them more than what I do.
Mm-hmm.
And so she was like, well, have you ever thought about child psychology? And I was like, no, but I'll look into it. And they didn't have child psychology, but they had school counseling. And I was like, close enough. I need to get into something before I call my mama and tell her that I flunked out of school.
Mm-hmm.
So
scary.
Right. And so I looked at it and I like loved it from day one and have never looked back. I was also in grad. It took me 10 years to get my doctorate because life was lifing.
I'm telling you.
I did the first 3 years in 3 years, and then that last year took me a little bit longer.
Yeah.
But I ended up getting my doctorate in counselor education and supervision.
Okay.
And I specialized my dissertation was in high school dropouts.
Mm-hmm.
And specifically, how do students who have already been identified as at risk, how do they determine whether they're going to drop out or not? I saw two ends of the spectrum. Mm-hmm. One was you have the like super rich who mommy, daddy owns everything. Mm-hmm. I literally had a student tell me, he said, come here, let me show you something. You see that? My dad's company owns that. That's my dad's company. That's my dad's company. I don't have to graduate. I don't have to do anything. So you have
great.
Right. You have that end of the spectrum, and then you have the polar opposite where they just haven't seen it, mm-hmm. and they don't see it as a possibility.
Mm-hmm.
And worked for 10 years in probation between Michigan and Texas. Substance abuse, how I specifically got into substance abuse is during my field practicum. During my field practicum for my graduate program, I was placed at a counseling center that was a part of a factory called Steelcase. They made furniture, and they had a counseling center on site for all employees and families.
That was progressive.
And it was a placement that everybody wants, right? Steelcase is really popular. They have an awesome free counseling program for all of their employees and families. So I go in there, and one of my first assignments is to lead and facilitate a men's alcoholic men's group. And my mindset was that I was going into counseling. I was going to be working with children and families. I really had this goal of like the LMFT type of goal where I wanted to work with children and families. And so, but to me, God had a different route for me. So God had a different route for me. And so I led this group, which I was terrified, and I loved it. And it's when I realized that, wow, substance abuse is what I want to do and where I want to be. So even when I became a probation officer, my cases were narrowed down to mental health and substance abuse. And I just thrived in working with people who had substance use issues, addiction issues. And so after moving to Texas and working in probation for a while, I then moved into the substance abuse treatment field, and then I ended up as the director of counseling intervention. But I first started as the coordinator of substance abuse education and prevention. So the scope was still specifically substance abuse, and then it broadened from there. So that's my story of how I got into substance abuse to where I'm at now. And then to Sharon,
I just learned some things that I didn't know.
Now we decided to do our own thing, to join forces and collaborate, and we're rocking it.
I love that.
And so I started out as a traditional middle school counselor.
Okay.
Did that for 4 years straight. Yeah, I did that for 4 years straight. And then I got homesick and moved back to Texas. And I ended up in Waco as an at-risk counselor.
Okay.
And it was a grant-funded position during the housing bust. And so at the end of that school year, we had no funding. And I either had to go find a job or go back to being a traditional counselor. But that position, I worked with the bottom 2% of cohorts. And in that semester's time, I was the at-risk the at-risk counselor, and then my counterpart, she was the graduation coach, and we worked with the traditional school counselors. And during our semester there, we increased the graduation rate, I think by 10% within the bottom 2%.
Wow.
And so that's where I found, like, this is my love. Like, these are my people. I like this population. So I was applying for positions, and I saw they had a position for the alternative school. And I was like, oh, a whole school of my people? Yes.
I want to be there.
Right. I want to be there. And so I actually applied to 2 different schools, and I'm going to take whatever comes first. But I really want this alternative school job. And that's the one I got. And so went in, learned very quickly about the substance use needs. And I had a student at the time, he was in 7th grade, I think. At the time, he was in 6th or 7th grade. Come to find out, he was one of the biggest drug dealers in this district.
Was that my 4th grader?
That was your 4th grader. He started out in 4th grade.
I had dealt with him in 4th grade. Yep.
Wow.
And I asked him, I was like, hey, I'm new here and I'm learning about everything. Tell me about the drug use in this district. And he said, let me think on what I need to restock on. And he said, well, this over here at this school, they like da 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 da. At this school, they like da da da. And he just came up, and then I called Marcene and I said, hey, this is what this student just told me. And she said, let me look at the what she was just telling you about, the drug trends data. And she said, everything he's telling you matches with the data. And I was like, okay.
Okay.
So that was my introduction. And then because that's where I was, Marcene suggested, she said, you really should go get your LCDC because you're doing the work anyway. You might as well get your license in it. So that's what I did. And so I worked as a counselor with an emphasis on substance use and trauma at the alternative school, but it ended up being pretty much for the whole district. Marcene was like the number 1 person. I was the number 2 person when it came to substance use for the district. And so that's work. And then from there, I wanted to, because I knew I wanted to teach graduate level.
Yeah.
And so I was adjuncting all that time. And then in 2021, December 2021, I left the schools, the public schools, and I went to teach at a graduate level program, and I did that for about a year. And I learned that although I really, really love teaching, love it, love it, love it. But I missed counseling.
Yeah.
And I miss group counseling. And so I stepped away from that, and Marcene and I started our business. And so here we are. And once this gets all settled, I want to go back and do adjunct after we get through with, once we get past the startup phase of it all.
Yeah. And like, that's crazy. Like a B-, literally like changed your life for maybe the better.
Yeah.
Like, that's amazing.
Yeah, I had no intentions of going into counseling, definitely had no intentions of going into substance use counseling, but this is my jam.
You just fell into it. I love that. I don't know it. And I should have started out like, hey, like, you're talking to this stranger, like, let me like say something about myself. But like, I mean, kind of similar, not similar in really any aspect, but the similar of like, it just kind of like dropped in my lap a little bit. I graduated from tech with a human development family studies major. My minor is in addiction and recovery studies. I did it because I was already halfway there and might as well finish out my minor,
one of the best places.
Right. So I graduated in 2015. They were like, Maddie, you should like get license or, get your license, whatever. I was like, yeah, whatever. Didn't do that. Went straight into corporate, soul sucking. Let me tell you, soul sucking. You win some, you lose some, making good money, but like I was a flower dying in a cube for real. Always wanted to go back into counseling, or wanting to go get my master's in counseling. And then I landed a job at Tarleton after my corporate job. I was a contractor, 3 years was up, and I was like, great, I don't have a job. I need one. Tarleton landed in my lap. So I've been there for 5 years full-time, working in the criminal justice and public administration department. And finally kind of COVID kicked my butt into gear and was like, okay, like, what do you want to do? Like, is this it? And I'm like, okay, let's double down and like get my master's. So here I am 2 years in. I'm doing the part-time gig because, you have to and life's, and I still try to have a life outside of school and work.
How long have you been working on your master's?
2 years. So I'm halfway done.
It took me 5 years to get my master's. Because I had 2 kids during that time. I got married. I mean, and I worked full time. I went part time. So, I mean, it's life. So just, don't beat yourself up. Took me 5 years to get my master's.
That's like, y'all don't know. That's encouraging. And I tell myself all the time, like, I will never quit because I've come this far. Like, we're going to do the thing. But I'm like, is it a graduate degree if you don't want to quit at some point? So I'm on the right track. It's fine.
There you go.
Also, I saw that y'all became friends on a job interview. I love that.
Yeah, we have a story.
I would love to hear your story.
Which is how I met Tashara, because I interviewed her and we clicked from the time of the interview. She was a counselor on my team for 10 years. But we were friends outside of that. So it was a dual relationship, and that's how well we got to know each other.
So, and I saw on y'all's website, like, you go into businesses to do, like, you consult in what aspect?
Pretty much whatever they need.
Okay.
So with some businesses and organizations, it might be they need help with building a coalition. They don't know how to do community coalition building. I teach
planning.
Yeah. I like research. So we talk about doing the community or staff needs assessments and
Programming. Some of them just want to
Yes.
establish programming, and that's what I've done is
Yes.
built programming. And so we just kind of share our expertise and
they
you
kinda
know,
like pick from the
kind
menu.
of just, yeah.
Y'all are
And
like
work
the
together. Oh,
ultimate
that's Tashara.
partnership.
Oh, that's Marcene. Oh, that's Tashara. That's I mean, even if we get a client who we know, you know what, you'll be better off with, you know,
Marcene
the
than with
other
me,
way. I mean,
right.
that's how we work. Like that's a Tashara person. That's who's gonna serve you best.
And we've worked together for so long that we know
Yeah.
who would be a better fit for what.
Right.
Y'all are literally the like power couple. Like I love that
That's
so
our work
much.
life.
I love that. Y'all are like, I mean, I like knew that y'all were gonna be very knowledgeable. Like I just had a feeling, but like, wow. Like the combination between you guys, you both are just, it's phenomenal. It's phenomenal.
Thank
Y'all
you.
are amazing.
Thank you.
People.
Thank you.
I know I'm gonna probably keep saying this, but like very inspirational to me. Just like all the work you've put into your careers at this point. And I know you've helped a ton of kids, adults. Like, what does that look like now in your practice? Do you still work with kids? Are you mostly working with adults? What does that look like?
So for me, my primary focus is teens and young adults.
Mm-hmm.
We say we work with 5 and up. So we
Okay.
work with all ages. But we each have our areas that we prefer.
Absolutely.
And so I prefer working with teens and young adults.
I love kids. But I love adults too. I went from probation with adults and young adults and then treatment and detox with adults to working in the school district. So it was a big transition for me in working with adolescents, but I loved it. I have a love and a passion for working with women.
Mm-hmm.
When I was in the treatment field working in detox, there were so many women that came in with addiction to pain meds because of reproductive issues and surgeries and different things like that, and just watching how women accidentally become addicts. Like it's like and a lot of it has to do with just lack of self-esteem and self-worth. And so I just have this passion for women. So I do a lot of women empowerment work.
And so like talking about just like women's issues that can kind of go into like coexist, like substance use disorders coexisting with like, you know, anything.
Anxiety, lots of anxiety,
So
co-occurring with addiction, lots of depression.
Yeah. So are you, what just kind of like I guess the question I have written down is potential for substance use to mimic and coexist with medical and psychological disorders and diseases.
It is rare that substance use does not co-occur with some other form of mental health.
Mm-hmm. I'm really big in holistic thinking, right? Because it's never just like one thing. Like I think everything is connected in a sense. And I'm in psychopharm right now as my other class, and like how can you like just like separate the two of like just like chemical dependence and like mental health, because it affects everything.
The brain disease.
Yes,
that is literally the definition.
That's what like Marcene said, just like women just accidentally becoming addicted to painkillers. Like women's health is like a whole separate issue, and
It is
that's mostly not taken seriously, and women are just in pain, and so they're gonna manage it however they can.
It is. You get fibroid tumors or hysterectomy or anything that's going on, and you get Vicodin, hydrocodone, Percocet, all of these things, and you know you becoming. I mean, I can't tell you how many women came in treatment because, and I called it. I'm like, this is crazy. These accidental addicts from addressing,
I like
you know,
that.
female reproductive issues in their prescribed pain meds and get addicted. And their life is turned upside down.
Absolutely.
That is,
So
it like literally blows my mind. Like the deeper I get into it, the more I feel so strongly about it, because like I see it in my friends, like I see it in myself. Like, I mean, my friend has endometriosis, and she can't get help. She can't
they
get
just
help.
started recognizing endometriosis. Before it was you're making up the pain in your brain because there's nothing going on in your body. So
Exactly.
here.
right.
Exactly.
And
So
now you have these new pain clinics, and I think we've come a long way, but we still have so much work to do. And really there needs to be some better management of doctors and prescribing medication, and getting to know patients, and having a better understanding of who they're working with, and having a better understanding of just addiction, you know. And I just that's a whole nother, it's a whole nother thing, is it all of that, but
yeah, no,
that's where it starts.
I literally just had that conversation with my mom about my grandpa, and just like he was on, you know, like just the older you get, the more medication you're on, and he just had a knee replacement, and like they literally just gave him all the pain meds, and I was like, Mom.
Yep.
And she was like, I know, because my family, like, we're just like, we're gonna wean you off in 3 days. Like, if you don't need it, we're not taking it. We're not messing with that stuff. But like, just prescribed him all this stuff. I said, you can't give him all that. It just, I mean, you know, just coming from what I've seen in my family and doctors,
Yes.
and everything. So preach it to the choir here, preach it to the choir.
Yeah, so many things.
Yeah, but I appreciate the work that you both are doing in that sense of it's just hard. It's hard work, and y'all are doing it. So it's appreciated for sure.
And then Xanax with anxiety is a whole nother issue, a whole nother, that's a lot of women too, just you know,
The Xanax,
debilitating anxiety.
taking the Adderall for weight loss.
Yep.
I don't even think
even now what they have, what's the new one, the diabetes medication that people are taking for weight loss and have no idea.
Oh yeah,
what it
no
does
idea.
to the rest of the, it's just.
And that's those extreme self-image issues that, you know, that young women have.
Some advice you would give someone who is thinking about working with people with substance use issues?
To throw out their preconceived notions. To throw it out.
You have to be so open-minded to be an addiction counselor, because anyone and everyone is prone to addiction. Anywhere, anyhow. And even, I mean, even me, myself, once I started in the work, I'm like, whoa, wow. It is not, you know, the dealer is not the kid on the corner, you know, in a hoodie,
right?
You know, and who the dealers are, and who the addicts are, and who's prone to abuse. I mean, it's anybody. And I think that's why there's such a stigma, and why there's such a delay, and we're stuck in the work that we need to do, is because of preconceived notions, like Tashara said. So what we're doing now,
love it.
Is I love it, because I mean, we're experts in the field, and we can embrace that, and we know, and we're doing the work on our terms.
Yeah, that's what I like about what we're doing. We're doing the same work, but we can do it to a larger level and with fewer restrictions.
Yeah. So
and walk in our own truth, and it's authentic. I can be who I am 100%. Dr. TJ can be who she is 100%, and we just join forces together and we make it work.
I love that. I love that. And like, I mean, so like, that's really all the questions I have. I think we've covered a big old block of things. But like, do you have like anything you kind of want to add, like wisdom, or just a
My
tagline?
wisdom is don't lose yourself in the process of it all. In my master's program, the two things that I learned that they emphasize that have helped me throughout my career. One is, they called it the hierarchy of the L's: life, liberty, licensure, livelihood, likability. So when you have an ethical dilemma, those are the things that you need to consider. Those are the 5 things that you need to consider. And then the second thing is they taught us self-care. I realized that I am able to I compartmentalize anyway, but I prioritize self-care because it was taught to me to prioritize self-care in my master's program.
I'm impressed that they taught you that, because
it was not taught in my master's program. And so it's just something, it's taken me a long time to really but I think as a leader, I had to learn how to, because I had to take care of my people. So I had to learn self-care for myself.
And she took very good care of us. Very good care of us.
I did. And sometimes I would forget that I needed to take care of me too. So self-care became an overall priority, but that was on purpose because I wasn't taught that in school. So that's number one. And number two, every client you work with is different, and success for every client is different. I know for some kids, if they walked in the door of the school, but they were high, the fact that they came to school was success for them. And that looks very different for the next person. And I have to remember that with every single client, specifically every single addict that I work with, that they are all very different, and that success and their goals need to look very different.
That's a success.
And
progress is progress.
Progress is progress. And I think when you said, what do you need in this work? You need patience.
Very.
Because baby steps are monumental for some people. And you need a lot of patience when you're working in counseling as a whole, but specifically in addiction counseling.
I used to have students, I had a big dry erase board in my office, and students would put up a nickname or their initials or whatever, and they would put numbers by it. And it was how long they had been sober. And whatever their definition of sober was. Let me put that out there too.
And it's a win.
Yes. And so I would have, students who were like, man, like, I gotta tell you, I did such and so last night, and da 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 da. I said, well, when did you take it? And they would tell me. I said, okay, did you take any before? So it's been 5 hours since you took anything. So let's start right here, hour 1. So I said, put your 1 on the board. And we would celebrate. You know what? You might have did that at 2:00 this morning. You had the opportunity to do something between 2 and 8, and you didn't. So let's celebrate that. And then at the end of the school day, you know what? Did you go into the bathroom? Did you do anything at all during the day? Nope. Hey, change your number. And tomorrow you might have to erase it and start back with that 1. But they made it through a school day. And for some,
accountability is huge with addiction treatment, and group accountability is huge, more so than any other counseling. I think is accountability is huge from person to peer to peer.
And like, I mean, I think just from what y'all said is your capability of like, 1, seeing the positive, and 2, being able to celebrate like the small things. And like, I think that's something I was literally talking to my friend about this last night. I was like, we need to get better at celebrating the small things, because it's still worth celebrating.
Right. Because we have to remember there are esteem issues, there's depression, there's anxiety, there are things, and depending on how long they've been in this process, they don't feel value in themselves, or at least other people are telling them that they don't have value. And so while on the outside, like, you are celebrating them because they came to school 5 hours late, or they just got off a bender. But they're alive and they came for help.
And they're here.
Because sometimes school is a safe place. I'd have kids go on a bender one of my babies. And
I think we're
when
thinking
he
of the same
got
one.
to high school, after maybe a week and a half, the only reason he came is so he could call me from the counseling office. And to me, that was success.
He said,
Because
if
I
we're thinking of the
provided a
same
safe
one,
place. And had he not come, what else would have happened? So it's just, and it's helping people understand that too. We worked hard to, there's this stigma, this misunderstanding, and helping people understand that that was a lot of work too, just getting people on board to do what's best for kids.
and I used to tell students I would give them my business card. And one in particular, I was like, hey, we're gonna put it right here behind your phone case and put one in your wallet. That way, when you're found on the road dead because you've overdosed, they can have somebody to reach out to. And he ended up going to the emergency room one day and he wouldn't do anything. And he pulled his phone out and said, her number's in there, call her. And I left work and went to an emergency room to go get him to do what the doctors needed him to do. And also I would tell, and I learned from Marcene, this one of like, you know what? I know what y'all are doing stuff. So what I need you to do is, again, between your phone and your case, write down the stuff that you usually take so that when you, again, put it in your wallet, put it in your phone case, whatever, so that when the emergency happens, they can have some idea of what might be in your system. And so I believe it. I'm not here to convince you not to use any substances. I'm here for you to be informed and educated and for you to make whatever choice, an informed choice. And it's because you're gonna make whatever choices you
And
want.
even harm reduction.
Reduction,
you know, sometimes
I'm a believer
sometimes
of harm
the
reduction.
best you're going to get is harm reduction. I used to do street outreach for MHMR, and we would go out and give out needles, clean needles. And people would be like, well, why you or go and take people to the methadone clinic that were on heroin, be like, you trading one drug for the other. I believe in harm reduction. And if they're gonna shoot up anyway, give them clean needles, give people condoms, that's the type of stuff we did at street outreach. It was grit work on the street. And it was harm reduction. That was our goal. And sometimes that's the best you're going to be able to do.
And it's hard for people to understand that. It's hard for them. And I'm like, it's the whole like harm reduction that like, I talk to my parents about like, hey, this is the goal, right? Like if people are going to be doing this, which they are, harm reduction. And they're like, I just don't understand, why would you do it? And I'm like, but that's not the question we need to be asking.
During COVID, I had a whole conversation. I said, y'all know why COVID is running in this campus. I said, y'all stop sharing vapes. Stop sharing hookahs. If you're not supposed to breathe on each other, you're not supposed to share a vape either.
Or pass along a blunt. I'm like, y'all still sharing blunts. These are the real conversations you have to have with kids. I'm like, so
have your own tip at least.
Yes. Yes. And that's the thing, like, no one thinks about. You don't think about that. You're just like, yeah, pass it to me, Yeah. Y'all want. I like genuinely have enjoyed our conversation significantly. Like, I am so happy y'all said yes. I can't thank you enough. Y'all are wonderful educators. Both of you combined, you have so much knowledge to give. Wow.
But thank you so much. It's been great.
Thank you so much.
Bye.